What is your name and where are you from?
My name is Stephen Pont. I'm a pediatrician, and I was actually born in England, but mainly raised in Texas, and now I live in Austin, Texas.
So, how did you begin your experience in Guatemala, and what are some of your takeaways and things you've learned while you've been here?
So my time in Guatemala goes back to my undergraduate degree when I actually was able to study in Costa Rica for 6 months, and as part of that time was able to travel some around Central America and really fell in love with the Latin American culture, particularly in Central America and Mexico. And on that trip in 1995, I didn't make it all the way up to Guatemala, so I knew that was one place, especially hearing from friends who had gone there, that was on the short, near future bucket list, kind of ASAP as soon as I can get back there. So then graduate, and I wanted to go to med school, but took a couple years off to work and travel. And so part of that, right before med school, with a couple of friends, we were able to travel back from Texas down to Costa Rica and by land. And part of that included some time in Guatemala, which again, is really when I fell in love with the country. I was like, I really want to go back there again once I have the right skills to try and be helpful to the country. So then fast forward and still remain with that interest in international health. And when I was at UT Southwestern, we did a couple of medical mission trips to the Texas-Mexico border that were always very enjoyable. But those are short-term trips, setting up clinics, doing some important work, but it was a take-home point for me that I'm not really changing the world by doing this, and I wasn't really sure if the people were getting more out of it than I was of the experience being a part of a clinic that was set up short-term, because especially for more primary care medicine, you really need a long-term partnership with the community and with the people to really have that change happen that you want. If you are more a surgical specialty, you can fly in and really solve some important problems as long as there's a system to care for the patients afterwards. But if you're doing more community level change and doing more primary care, then you need a longer time or a permanent partner to work with. So knowing about those things, fast forward, went to med school, pediatric training. My wife and I did fellowships in Nashville, me in academic pediatric medicine, and got my MPH as part of that, knowing that I wanted to work with patients individually, but then also work to try and solve larger systemic population level problems as well, with also that interest of doing something international, because I speak Spanish and the majority of my patients have always preferred to speak Spanish. So enjoying doing that in my day job in Austin, and then also looking for opportunities internationally. So when we moved back to Austin, we found a church home to go to, and that church, it worked out, it already had a partnership with Guatemala. Our water team had been going down for a number of years. And building upon off that trip, I started to go down and made some connections here, and it's really grown into what we have here today. So our church, Shepherd of the Hills Presbyterian Church in Austin, Texas, had formed a partnership with Guatemala many years ago. It started with a larger group called Living Waters for the World that's interdenominational, and they find partnerships all around the world of a community that is interested in having a clean water system installed, and then the community members help to install it and then maintain it afterwards. So our church had a group that was already going down to Guatemala for, I think, a decade or so, and had started these partnerships. And basically, they'd find a community, they'd make sure the community was interested, and that the community would commit to working with them for at least 3 years, and the group would commit to coming down for at least 3 years to maintain the system, make sure everyone's up to speed on how to care for it. And the goal is really to have clean water at a much lower cost than folks who are having to buy it in the store, and then also have it low enough cost that people aren't just going to drink unpurified water because of the cost. So our church had put in a few of these systems. They go to one spot, they partner and make some relationships there for 3 years, they move on to another one. One of those spots was a children's orphanage. It doesn't do adoptions any longer, but they have about 60 boys, and since then they've also started a children's home for girls and have about 20 or 30 girls there now too. They put a water system in there. Another place they put a water system in was a Guatemalan-founded nonprofit school, has a government school for elementary in the morning, and then a nonprofit middle and high school in the afternoon. And they had also received a water system. Those two systems were working great, and so the water team was going to look for another place to put in an additional system and continue that process. But at that point, some of the folks were like, we've made friends at the Hogar and at the school, and we would like to build those relationships, help them grow even deeper versus continuing to make more friends. So at that point, the team broke up into two, one that would have a Hogar and a school team, and one that would continue to put in the water systems. I started going down on that Hogar school team and became friends with the leaders of both of those places and a lot of the kids who were going to school, and the parents that were supporting them, and then also at the children's home. Slowly over time, I was able to look for medical opportunities and became connected with Dr. Estrada. And being a pediatrician and my wife also a pediatrician, looking for a way that we could also contribute our medical skills. And that since has evolved into us doing some programs here with Dr. Estrada, either first aid training or we've helped to provide some trainings for his nurses on how to care for a newborn baby. And then we've also created a new partnership with a Mayan nonprofit where we provide midwife training on how to resuscitate a newborn.
And on that note, I just wanted to ask another follow-up question. What makes helping people abroad meaningful to you? And why do you keep coming back to do it?
I love to work internationally. I think everyone could come to love it, but I think sometimes it's just in your blood to begin with as well. So I think working in Latin American cultures, because I love to speak Spanish and it just works for me and really fills my soul. I think that it's a good reset button for me to remind me of how much we have in the US, a lot of which we might not really need, but it's a good reality check of what other folks are struggling with around the world. And really, I do believe, those who receive more, there's an expectation for you to give back more. And I find this is one small way to try and contribute to that. I think there's a lot of things that we can learn too to help improve our work back in the US for working in lower resourced countries, because they're able to accomplish a great deal often with far less means. And so we can oftentimes apply what we learn here in international countries to be even more efficient and effective back in the US as well.
Is there a particular story you have of one of the most meaningful patient interactions you've had while in Guatemala?
I think the most meaningful interaction, and there's been really so many of them. Every time you come down here, there's like little miracles that are popping up all over the place. The leaders of these institutions, some of which they're basically feel like living saints of what they have to do, because we pop down here for a few days and to really understand what they have to keep going 24/7, especially when you're basically the sole provider for 80 children 24/7. That's a huge undertaking. But I'd say one thing that my wife and I, probably one of the most moving things that comes to mind, is we do a midwife training program. So these are for Mayan midwives who most have not had formal training in how to resuscitate babies. However, they have had decades of experience and mentorship, and that they learn very early on in their lives that they're going to be the midwife for their community. And so they have an apprenticeship program for many, many years. And so we come down and bring down a more formal training program. And we recognize that a lot of these midwives have decades of experience successfully delivering babies. And I think it's very important to always come at that with great humility, but they have great appreciation for what we're doing as well. So we bring down the mannequins. They come in shoebox sizes, and it also comes with some resuscitation equipment. And the women are able to keep all of those things, to keep practicing, to show others, and then some of the medical equipment they can actually use with deliveries and clean it and do it again. So we set out the mannequins for all the midwives, and they open the boxes and they look at them and they get them out, and they look very lifelike. It's like a doll, but proper resuscitation training can be done with it. They're pretty high end for what they are, which is great. And one of the midwives asked, she said, "Are these for us?" And I responded, "Yes, they're for you." And she teared up and started crying, and I was like, "Oh goodness, I said something wrong. I misinterpreted what she was asking." But I asked for clarification and why she was upset and crying. She's like, "Well, in my decades of living, I've never even owned a toy doll baby. And now you're coming down to give me a proper mannequin to help me care better for infants that I am caring for." And that just brought her to tears. So I think that was such a clear, heartfelt example of the power of this training. But we get so much out of coming down here as well, working with these women who are basically heroes to their communities day in and day out as well.